In this brief session, I will be kind of providing an overview of systematic review. I mean, I'm stressing some of these words as such, as well as meta-analysis. So we are doing, like those who have not heard this term, let us see like what these terms are and where it is used, and why do we actually need this systematic review and meta-analysis, and what are the pros and cons of using this, and what are the limitations of even this venture, and like how we can really make use of this technique of systematic review and meta-analysis. So once we see in terms of literature, I mean, like the amount of literature or amount of knowledge generated across the years, I mean, recently there is exponential increase in terms of number of articles published or research work published across the years. I mean, like you can see even millions of articles getting published every year. With just few numbers as such, you can see, I mean, like the database which is called as Medline, where it resources most of the medical related literature, about almost more than 1.5 million papers are getting published each year, which almost like, if even I'm speaking now, almost like about 3 papers are published per minute, even in PubMed. So it is at this rate, actually, literature is getting exponentially increased across the world, and I mean across the science as such. So with this much amount of research work which is getting in, I mean, like if you look at some of the stats in terms of number of publishers, I mean, this again 3 years old data, which says about there are about 10,000 different publishers publishing various scientific information in about 33,000 English journals, and even there are non-English journals, nearly about 10,000 journals publishing about more than 3 million articles per year. I mean, like more so, these articles were published mainly from 30 countries only. I mean, still, if you see, if all other countries increases, I mean, you see the amount of knowledge which is actually generated. I mean, with so much amount of knowledge generated, I mean, recently, even nobody can read all the literature and understand and keep up with what is actually happening in their own respective fields as such. I mean, as you see, I mean, just last in 30 years, our reading time per article has been reduced from almost like say 1 hour to 30 minutes because of number of inputs and number of papers which has generated as such. So even if you consider in terms of even increasing number of literatures related to only systematic review and meta-analysis, I mean, majorly the US is the one country which is almost having 80,000 publications, and which is like exponentially increased. But recently, if you see in some other countries like China and UK are like now increasing with almost like say 21,000 systematic review published in a very recent period. That will just last 4 or 5 years back as such. So now let us dwell into what actually this systematic review and meta-analysis. I mean, in terms of why do we actually need this knowledge synthesis, as aptly mentioned by our, I mean, during the introduction, our director and principal madam. So when we have this amount of knowledge, so we need some sort of summarizing way of looking at this information for our regular purpose. So when we look at in terms of evidence-based medicine, I mean, in terms of our during usual clinical activity, or even some sort of making decisions at varied levels, there is a demand for this evidence and knowledge. Once we say we have demand of this amount of evidence and knowledge, and this has been supported by these millions of papers, but if one's tried to go through these individual studies, but that study results may be kind of misleading in terms of various individual study related biases or random variations across the findings, what we actually see across different individual papers, even for a specific research question, which will help us in treating or making a clinical decision when we treat a next patient as such. So for this to overcome this method, so we need some sort of this knowledge translation tools. So I mean, that gives a kind of requirement for the synthesis or the summarizing of this knowledge through some method as such. I mean, this synthesis of knowledge should be able to interpret results of individual studies, which within the context of even the global evidence. I mean, the evidence is coming from nook and corner of the world, so we should be able to synthesize all this information which is coming from across the world for our betterment. So this knowledge synthesis is actually central to knowledge translation when we want to translate it into either when we treat the next patient or a policymaker to make the next decision, or even bridging the gap in terms of where the science is actually doing now and where the science should go future as such. So in terms of looking at this knowledge pyramid, I mean, evidence-based medicine knowledge pyramid, the systematic reviews goes at the top of this knowledge pyramid when you consider various study designs and study reports in terms of observational studies or experimental studies in terms of randomized control trial. The synthesized information from a randomized control trial, which is a systematic reviews, tops the evidence base for in terms of providing the synthesized evidence as such. Okay, then the question comes is, I mean, like giving the reasons for why do we need this synthesized evidence? As I already, I mean, kind of explored, there is information explosion, which is individual papers are coming in terms of millions of numbers. And when we see for each of this information, all the information are not equal grade. I mean, some are of high quality, some are of low quality, and some are of mediocre quality and coming from different cultures and different places, different settings. So all information which we get when we go through these individual papers are not equal in quality. Then we cannot call all informations as evidence. So we have like different sort of evidence which are coming even in the sort of gray literature as such. So even all information, we cannot consider this as evidence which can be really used for translating into our clinical decision or policy making decisions as such. And even there is, I mean, like there is conflict of information even across the literature. When we go for a specific question, let us see some of the examples in like my coming slides. Even there will be conflict of information even for a specific research question that we see in literature as such. Further, whenever we have this, we need this synthesized knowledge even for this translational tools. For example, if a policymaker wants to make a decision on which policy to choose or how to make a policy for in terms of at a population level. So we need like to prepare this policy briefs, we need knowledge synthesis. And for patients to make their individual decisions, I mean, for making a patient decision aids, which mainly happens in the European and American context, we need to, when we want to develop this patient decision aids, there this knowledge translation with synthesized information is necessary. And more so when we plan for a clinical practice guidelines, I mean, whenever we want to, I mean, the major guidelines which form, there you require this synthesized information. Further, nowadays, even when we start writing our research proposals or research grants, even some of the agencies nowadays, they require actually to conduct these systematic reviews, even when we are doing our routine research as such. So these are all the reasons where we actually need to synthesize the evidence in the form of systematic review and meta-analysis. So let us see, I mean, as I was describing, what are the challenges when we go through the individual evidences as such? So let us have a question. Like say, if a policymaker wants to know what is really actually burden of this dental caries. When we go through the literature, some papers say the prevalence of about 25%, while the others say 80%. Which one to believe? So we need some sort of summarized information. And these evidences comes from very small studies with very small sample size, as small as even 18 subjects, while the same question is answered in a study with more than 1,500 subjects. Which one to choose? How do we weigh these individual study evidences? And these evidences come from different study designs in terms of cross-sectional surveys or community-based surveys or school-based surveys. So these are all makes challenges when we actually go through this individual papers. Similarly, look at like another question, like say, which mouthwash really works out in terms of its clinical effectiveness? So when you go and search through either PubMed or some other databases or search engines, in the literature, we see different comparisons. I mean, different interventions compared to different comparators. And these evidences are again the conflicting. It says some evidences works in some paper, in some situation or some specific context, but in other papers it mentioned it doesn't work. And even the level of evidence, which is kind of could be measured in terms of either odds ratio or relative risk or hazards ratio or whatever it is. And there are different levels of evidences which are reported even across when we are trying to answer this question, which mouthwash really works for this dental plaques. So to answer such, to come across such limitation, so just to summarize, these kind of common problems when we actually do this individual trials in terms of individual trials maybe with a small size, which actually limits the statistical power to give the sufficient answer, and as well as it has prone to chances and biases as such. And even if it is from randomized control trial, it could be kind of single centered trial, which in terms of limiting into external validity and applicability as compared to like multiple trials or multiple sites of information as such. And another major challenge is this publication bias. Most of us who are in research would know that, mainly the positive studies are getting published more and more, and need to, more of there are various factors which influences this publication. Only certain kind of results only getting published. So these are the problems which actually face when we look at individual trials. So then the question, if you synthesize or at the level of researchers to plan for the next research grant, or even a policymakers to make his policy decision. So considering these kind of issues, the standard, the kind of principles of evidence synthesis should include, the summarizing of this from primary or individual studies should identify evidences across all the literature as possible. Identify all relevant evidences which are available. And there should be an objective appraisal of evidence. There should not be any subjectivity introduced because of our own interests or our own perspective. There should not be any individual subjective influences. So this evidence synthesis should be as objective as possible, and they should follow a strong or methodological rigor when they're conducting this evidence synthesis. In terms of mainly, why we focus more on this methodological rigor is to reduce the biases which can be kind of included during the review process as well, and also to focus on the internal validity of the included studies. And these evidence synthesis should draw conclusion based on the available evidences as such. So, considering all these factors, even most of the evidence-based literature suggests systematic review and meta-analysis are essential tools and are of highest level of evidence for making any such sort of decisions. When we look at various review methods, there are like several review methods you could come across. Some they say rapid review, some they say scoping review, state-of-the-art review. So I'm just briefly mentioning all these different sorts of reviews. If you someone is interested in more details, so they can go and get into this Grant et al. Paper of 2019 for more information. But however, in this today's work, we'll be mainly focusing on systematic review, which has during this, which searches exhaustively and comprising all the literature as such, and it objectively evidences. Synthesize the evidence as per the principles of evidence synthesis, and provide clinically or decision making relevant conclusions as a part of its outcome. These are again some more list of review methods, and where even meta-analysis also considered kind of review method when we do this evidence synthesis as such. So now, having all this background, if you want, say, a typical definition of a systematic review, as per this Klassen et al. So a systematic review is a review in which there is a comprehensive search for relevant studies on specific topic, and those identified are then appraised and synthesized according to a predetermined explicit method. So here the key terms are the ones which are highlighted. Systematic should it should be it should be systematic and it should be explicit. So systematic, we mean that we follow an appropriate method. A systematic method which is predetermined, and a standard one which is actually recommended by the standard guidelines, which is PRISMA and I mean the Prisma approach as such. So we will see a bit more details in the upcoming lectures as such. And whatever this key terms are not actually markers of a systematic review, but they are all characteristics of all well conducted and well reported systematic research as such. Now, briefly looking at, I mean, like historic roots of when actually the first systematic reviews and all conducted, it actually started even in early 70s. I mean, some of the early papers which actually synthesize in terms of work done breast cancer or in terms of vitamin C supplementation and surgical implement. I mean, like the field has grown from, I mean, like say for last 50 years as such, 50 or more years as such in terms of this synthesis of information as such. And to to look at how this systematic review differs from the traditional or narrative review in terms of choosing a review question or topic. Our traditional review or narrative review, which usually has like more of subjectivity, and it is like really broad and gathers information in terms of a particular viewpoint of the one who is really conducting that review. But while the systematic review, as it is like it's a well-defined research question, which is objective, and it is as far as unbiased and transparent, and it's conducted in a reproducible way as such. And in traditional review, the searching of evidences is very much limited and not well documented, but that more so we do it in systematic review in a comprehensive and documented way of reporting. And here studies are selected without, I mean, in traditional review, there could be a lot of chances of subjective selection of studies, while in systematic review, we have more objective and predefined inclusion and exclusion criteria to select articles. And in terms of quality assessment, which is much more lacking in traditional reviews, but in systematic review, we more give stress on this transparency as well as quality assessment of individual studies. And even the result reporting, and it's largely descriptive in traditional studies, while it is like synthesized evidence and it's replicable in systematic reviews as such. And in terms of conclusions as well, these traditional reviews are more so subjective, and here in systematic review, it is a quantitative outcome and it is more objective appraisal evidence as such. When we see what are the different even variations of the systematic review, if someone wants to look at which intervention works, so there is like a intervention related intervention compared to comparator related systematic review. Or if there are like more than one intervention for a specific disease, we can even expand it into something called as network meta-analysis or network analysis. Or if someone is interested in terms of diagnostic studies, which diagnostic tool has more sensitivity or specificity, or its diagnostic accuracy in terms of synthesized evidence, we have systematic reviews tailored to diagnostic tools, or even the genetic analysis, or even the economic evaluation. So there is varied but specific approaches for dealing with specific sort of research, which we are dealing even in systematic review and meta-analysis methods as well. And then we look at whether whatever the systematic review is really how it actually, whether it is same or different from in terms of best conducted randomized control trial. Some of the literature which suggests that which mainly goes in agreement with the best conducted studies, while the negative results are less reliable and more so. But however, if you see the values which are estimated, the effect size in meta-analysis, systematic review and meta-analysis as compared to the best conducted trial, so it goes more hand in hand in terms of that as well. Now coming to meta-analysis. So, I mean, the meta-analysis is a statistical analysis that combines or integrates the results of several independent clinical trials or even other clinical studies that are considered by analysts to be combinable. So, I mean, this is the key kind of term. These studies should be combinable. We cannot compare, what we usually say, apples with oranges as such. I mean, like there should be individual studies should be combinable in nature. Then if you ask question, why we actually need to perform this meta-analysis? So, all of us are interested in knowing a single number. Like if some intervention works out, how much is the magnitude of that intervention? And we synthesize this information. So that meta-analysis will provide. And this meta-analysis will actually increase the statistical power of because it combines from multiple primary study results, and it actually assesses the amount of variability across what our final finding or observation which you gain from this meta-analysis. And it helps us to identify study characteristics in terms of while conducting sensitivity and subgroup analysis. And it actually gives actual treatment effect, and it by conducting this meta-analysis also helps in more timely introduction of effective treatments as such. In this meta-analysis is not just, we cannot just equate it to simply averaging of studies. I mean, like, why we say this, when we average doing that when we conduct a meta-analysis, so we give what we call it as weightages to studies depending on whichever is giving the best answer, or the answer which is more closer to the truth than the others as such. So that is actually done through weighing of studies. So we weigh the studies result from across the studies which are included in the meta-analysis to give that much weightage to that evidence coming from such literature as such. So some of the common weightages which we use is in terms of if studies are with the maximum number of population, or which has like lower variance in terms of its observation. I mean, these are all the ones which we usually weigh the studies in meta-analysis as such. And this weight is closely related to the width of the study's confidence interval, which usually we use 95% confidence interval. If you say, like, if there is a wider confidence interval, those studies are weighted less when we synthesize this information. Then the question comes is, when can we actually do this meta-analysis? Actually, how many studies is really required to do meta-analysis? I mean, the theoretical answer is like, even if you have like even at least 2 studies, you can actually do a meta-analysis. But the ideal thing is like in more the studies, that much increases its validity and reliability across. I mean, like more the literature or more the information, that would be better. And there is these primary studies should be combinable. As I mentioned, there should not be major differences in terms of study characteristics when we combine these study results. And even the outcomes in those individual studies should have been measured in similar ways to make it more combinable. And as such, I mean, there should be data available for even combining those results as such. Okay, now we have seen all the positive aspects of systematic review and meta-analysis. Now let us have, even this is not like, this method is not like 100% foolproof or unbiased. I mean, these things comes out when we actually not follow a systematic and a standard predetermined approach as given by standard agencies or a standard methodology. I mean, all these limitations we get only when we not follow in systematic review and meta-analysis include. It depends on the quality of the primary studies. Like the saying, if garbage in, garbage out. Like if the primary studies quality is less, whatever you do in terms of after like systematic review and synthesis, it will be of that much less useful or reliable output with systematic review. And we all know with this publication, in terms of this publication bias, we know that, I mean, usually most of the papers which are showing this p-value of more less than 0.45 are getting more published, are significant results. So these are the chances only these papers are published, which actually studies with negative effects might not be even published. So introducing this publication bias. And positive results are more likely to get published, and this could be kind of captured more in our systematic review when we included this primary studies. And even the published trials, even more positive trials, and these trials are getting more published even in English. So even some of the literature related to, like, say, some environmental factors and some specific diseases, they are published more in terms of Russian or Spanish or these languages, not more so in English. So if we do review only including by English languages, we may miss certain disease characteristics or some evidences which are even reported in languages other than English. So this, I mean, this could even introduce some sort of bias or limitations in systematic review. The other limitations include this time lag bias. I mean, when we actually search term, we include, and there's a time lag bias. What we try to mean is, I mean, the time difference between the when it is published and when we actually kind of included in our systematic review and meta-analysis as such. And there is chance of including this multiple and duplicate publications, because whenever some researcher conducts a trial, they'll be published in multiple publications through piecemeal or SIAMES publications, or there various such sort of thing. If you include those, that could introduce biases in systematic review. And even the citation bias, I mean, more cited papers are included. Again, the language, in terms of introducing certain languages, and even outcome reporting. So usually researchers tend to publish only the positive results, so that could introduce outcome related biases. Considering all this, I mean, like when we do when we follow a standard and appropriately conducted systematic reviews, are more likely to reduce all these biases and make the results as that much more reliable. Now, looking at what and all actually resources which are required when conduction of a systematic review and meta-analysis, it is considered that about more than a year is required for conducting a standard systematic review and meta-analysis, which requires a time of, say, more than 100 hours of time of researchers in conducting this. And it also needs a trained manpower. I mean, like average reviews, which actually has about 5 persons, plus or minus 3 subjects when needing to conduct this. And even they say, I mean, like published studies even take even longer time, and more members are required when conducting such things as such. So the overall, when we look at systematic review and meta-analysis, these are the systematic reviews. It actually offers a rigorous and scientific approach for summarizing the evidence. And the main aim of the systematic review is to reduce the error and biases of individual studies. So when we start with a good question, develop a standard, good methodology to answer the specific question, and to collect all the relevant data across the literature, analyzing the data in an unbiased way to draw meaningful conclusions using this technique of systematic review and meta-analysis. And this meta-analysis actually offers a ways of pooling or combining several numerical data published across studies. And one thing to remember, this SRMA itself is a major research project where actually subjects are the published papers or published study, or it can be both published or even unpublished studies as such. So this is a brief overview of the cycle or steps of systematic review. Today, I think most of my colleagues will be touching upon each of this topic with varied subjects as such, in terms of framing a research question, framing of eligibility criteria, conducting the literature search, how do we actually conduct that, study selection and data abstraction, assessing the study quality, and then once we assess the quality of study, then how to analyze the data and how to present the data, and finally, as a writing a manuscript and publishing it. Thank you all.